Greetings, YouTube family. It's been a while since I've been on live. I received some information in my news feed. I do get very regular, I should say, news information about health topics. And this came about in my news feed. I heard about it a couple of days ago. I just thought to wait to do a show and see if any more information. Many of you may know that Snoop Dogg's daughter, Cori Broadus, suffered a stroke. She was only 29, is only 24 years old. And here's an image of her. And she shared this with her followers on Instagram Thursday morning. She shared, the fact that she was in the hospital and that she was quite distraught about this. And this is a very unfortunate event for someone who's so young. And what I want to do today is share with you some important medical information that may be helpful to you. Now, oftentimes when I do topics like this and talk about individuals, famous individuals who've suffered certain medical problems, questions come up, well, you one of the treating doctors, etc. I'm not one of her treating doctors. However, this issue of stroke is one that's important. In my medical practice, I've seen a number of individuals with stroke. Typically, we see individuals who are older who suffer stroke, especially individuals who have multiple cardiovascular disease, heart failure, cardiac arrhythmias. Atrial fibrillation is a cardiac arrhythmia we're seeing more and more of these days. And individuals are suffering from a stroke as associated with cardiac disease, arrhythmias, but also cerebral vascular disease. And so I'm going to talk about that, but I'm also going to talk about, what issues that a young person can have. So why would a 24-year-old female have a stroke? You would think someone this age should be, quote unquote, immune from diseases such as stroke. So I'm going to share with you this. First of all, she was quite distraught. As you can see, I had a stroke this AM. I started breaking down crying when they told me I'm only 24. What do I do to deserve this? And as you see, she's one of 3 children of Snoop Dogg. His real name is Calvin Cordoza Broadus Jr. He has 2 sons, one Cori and one Cordell. He has with his wife, Shanti. So anyway, we all know who Snoop Dogg is, and a very unfortunate issue, but many individuals will be, talking about this. And so I want to take advantage of this unfortunate situation. Hopefully we can turn this around to a positive thing. So you may have had a family member who suffered a stroke. There's also a condition known as transient ischemic attack, or TIA. People refer to them as mini strokes. So this is a condition where you start to have stroke-like symptoms and it clears up within 24 hours. So there are many things that can be associated with stroke. So what do we need to know about a stroke? And how should we, recognize someone who's having a stroke, and what action should we take? But more importantly, how should we prevent the cause of the stroke? So let me share this with you. I want to share this screen. So first and foremost, what is a stroke? Essentially, people refer to it as a brain attack. It's essentially when blood flow suddenly stops in a certain part of the brain. It can affect your ability to move, to speak, to eat, to think, and remember. You might lose control of your bowels, your bladder, your emotions. There may be some facial muscle changes. You may have a facial droop, etc. Most of us know the common risk factors. However, they're high blood pressure, heart disease, as I mentioned before, diabetes, smoking is a common thing. Birth control pills. Many women who are on birth control pills, this can predispose to clotting in the veins and lower extremities. If you've had a history of what's called a mini stroke, or TIA, then that implies that you may have a higher risk of a stroke than someone else. People that have increased red blood cell counts for different reasons, maybe a smoker, your blood count builds up because of that, and maybe other reasons. High blood cholesterol and lipids, fatty substances in the blood can help build up plaque in the arteries in the brain as well as the heart. Lack of exercise, obesity, is a common cause, and excess alcohol use is a very common predisposition to stroke. And illegal drugs, crack cocaine is one that we see often in the clinical setting. And of course, abnormal heart rhythm, I mentioned earlier, individuals with atrial fibrillation may be predisposed to suffering a stroke because the irregular beating of the upper chambers of the heart can cause slushing of blood and can cause buildup of blood clot in different pockets of the heart. These pockets we call either left atrial appendage in the case of a stroke, but sometimes can build up on the right side and cause blood clots in the lung. Structural abnormalities of the heart, abnormal heart valves, particularly the mitral valve or the aortic valve, can predispose to stroke. Of course, older age, Black Americans are at increase, have a greater incidence of stroke than white Americans, men more so than women, and of course, a history of a prior stroke obviously predispose you to a stroke. Prevention is obviously the best cure. You want to take care of your health in a way that you prevent, or reverse high blood pressure, reverse type 2 diabetes, reverse these conditions. And if you want more information about this, go to our website on montgomeryheart.com and you can get more information about this. However, there is a situation where young women can have a stroke and be particularly aware of. And these things are birth control pills, as I mentioned. In young women, type 2 diabetes and obesity are common causes. But autoimmune diseases, so if you have a young person, if they're not obese, they don't have hypertension, you want to search for an autoimmune disease. Lupus, for example, individuals with lupus can have stroke. Birth control pills, I mentioned, again, that's in young women. Different immunizations. We've had a number of people who've had immunizations against the C virus. They've had increased stroke. This happens in young and the old. And you also have certain infections, sexually transmitted diseases can also predispose to stroke. So there are many different, causes of stroke in both the young and the old. First and foremost, you want to prevent disease. So if you're a drinker or smoker, obviously you want to stop doing these things. If you consume, a poor diet, lots of processed food, lots of fried foods, you go out to restaurants and parties and you like to, drink, and some people smoke cigars and the like, you're only setting yourself up for cardiovascular disease, stroke being one of those cardiovascular illnesses. So again, I want to take the opportunity to shine some light on this issue. It's a very critical issue, and it's a very tragic event for such a young lady. And our thoughts and prayers go out to her and her family in a speedy recovery. And I hope that this is something that you'll benefit from in terms of knowing what the signs and symptoms of a stroke are. So in the event that you or a loved one are suffering these signs and symptoms, you seek immediate attention, because we get immediate attention. You can get medical care, and there are many centers that can reverse a stroke that's started. But more important than reversing a stroke that started, you want to prevent a stroke from starting. And you take these aggressive lifestyle measures, and this will make a big difference in your life. So I hope this helps you out. Please like, subscribe, and share this video. And until next time, you take care.